Module 2 delves into the practical, evidence-based principles and practices of vocal hygiene, which refers to the daily habits, environmental controls, and behavioral modifications necessary to preserve and optimize vocal function. While Module 1 focused on the anatomical and physiological foundations of voice, this module emphasizes how external and internal factors impact the voice on a daily basis, either promoting vocal health or contributing to dysfunction. This module integrates knowledge from otolaryngology, speech-language pathology, vocal pedagogy, behavioral health, and occupational voice therapy. It addresses the cumulative effects of hydration, vocal load, dietary choices, sleep, environment, and lifestyle on the integrity and longevity of the vocal mechanism. You are guided to build sustainable routines that proactively protect the voice from strain, inflammation, fatigue, and long-term damage. Key learning objectives. By the end of this module, you will be able to define vocal hygiene and its relevance to daily vocal performance, identify and modify personal and professional habits that threaten vocal health, establish a customized vocal hygiene routine that suits their lifestyle and profession, understand the biochemical and physiological role of hydration in vocal fold lubrication, evaluate the impact of sleep, diet, emotional health, and environmental irritants on voice, recognize the symptoms of poor vocal hygiene, and intervene before damage occurs. Promote long-term voice care through mindful behaviors and preventive strategies. Section 1. What is vocal hygiene? Vocal hygiene is the practice of maintaining and protecting the vocal mechanism through conscious daily habits, risk factor management, regular vocal rest and recovery, awareness of vocal misuse and abuse. Vocal hygiene is not limited to warm-ups or therapy sessions. It includes nutritional choices, water intake, environmental exposure, sleep hygiene, emotional regulation, voice load management. It is both preventive and proactive, applicable to everyone who uses their voice frequently or professionally. Section 2. Hydration and its role in vocal health. Water is the primary lubricant for the vocal folds. Adequate hydration ensures optimal vibration of the folds, reduced collision force between folds during phonation, lower phonatory threshold pressure, PTP, enhanced vocal stamina and recovery. Key concepts: systemic hydration, drinking water to hydrate tissues from the inside; surface hydration, using steam inhalation or humidifiers to moisten mucosal surfaces directly; dehydrators, caffeine, alcohol, spicy foods, certain medications, e.g. antihistamines, decongestants, can dry out vocal tissues. Recommendation: 2 to 3 liters of water per day, adjusted for climate and activity. Section 3. Voice rest and recovery. Just like any muscle group, the voice needs rest after extended use. 2 types of voice rest: complete voice rest, no speaking, singing, whispering, or throat clearing; relative voice rest, minimizing voice use and avoiding vocal strain. When voice rest is needed: after long speaking or singing sessions, when experiencing vocal fatigue, hoarseness, or soreness, following illness or surgery, especially laryngeal. Voice rest should be proactive, not just reactive. Scheduling vocal breaks during the day can prevent overuse and allow for tissue recovery. Section 4. Dietary and nutritional impact on voice. Diet plays a significant role in systemic health and mucosal integrity. Foods to prioritize: water-rich fruits and vegetables, omega-3 rich foods, reduce inflammation, herbal teas, non-caffeinated and non-acidic, anti-inflammatory spices, turmeric, ginger. Foods to limit: dairy, can increase mucus production in some individuals; acidic foods, tomatoes, citrus fruits; fried and spicy foods, trigger acid reflux; sugary items and carbonated drinks, gastroesophageal reflux disease, GERD. GERD is a major contributor to vocal damage as stomach acids irritate the larynx. Symptoms include morning hoarseness, chronic throat clearing, sensation of a lump in the throat, globus pharyngeus, dry cough. Voice users should avoid eating close to bedtime and elevate their upper body while sleeping to manage reflux. Section 5. Sleep and circadian impact. Sleep influences: vocal muscle recovery, mucosal hydration, cognitive linguistic performance, immune function. Poor sleep hygiene leads to vocal fatigue, decreased breath control, and loss of vocal precision. Recommendations: 7 to 9 hours of sleep per night. Establish a consistent sleep schedule. Reduce exposure to blue light before bed. Section 6. Emotional and psychological stress. Voice reflects emotional and psychological state. Stress manifests in muscular tension, jaw, shoulders, larynx, shallow breathing, elevated vocal pitch, decreased projection or vocal strain. Chronic stress may cause muscle tension, dysphonia, MTD, poor breath support, increased vocal fatigue. Solutions: daily breathing relaxation exercises, journaling and emotional expression, counseling or mental health support when needed. Section 7. Environmental considerations. Environmental irritants significantly influence vocal health. Dry air dries vocal folds and increases vocal effort. Dust and pollutants. Inhaled particles irritate the respiratory tract. Cold temperatures constrict muscles and reduce flexibility. Tobacco smoke directly harms laryngeal tissues. Voice-friendly environments. Use humidifiers, especially in air-conditioned or heated spaces. Avoid yelling or talking over background noise. Reduce exposure to allergens and toxic fumes. Section 8. Harmful vocal behaviors. Voice misuse or abuse includes yelling, screaming, or loud talking, prolonged talking without hydration, frequent throat clearing or coughing, speaking or singing while sick or hoarse, whispering with tension, worse than soft speaking. Habitual misuse leads to edema, swelling, nodules or polyps, laryngeal fatigue, loss of vocal range and flexibility. Section 9. Building a daily vocal hygiene routine. Daily checklist. Drink warm water throughout the day. Do light vocal warm-ups before long speech or singing. Use steam inhalation before and after heavy vocal use. Avoid vocally abusive behaviors. Rest the voice during breaks. Manage acid reflux and allergies. Practice mindfulness and physical relaxation. Section 10. Tracking vocal health. Create a vocal journal. Tracking hours of voice use daily. Hydration intake. Symptoms: hoarseness, dryness, fatigue. Environmental exposures, vocal rest periods, emotional state and stress level. This journal can help detect early warning signs and support medical consultations when necessary.